When you have tennis elbow, you nearly always hear how important it is to rest it as much as possible while it heals, they say. Unfortunately, the idea that healing will just happen while you're resting and waiting is a misconception when it comes to tendon injuries like tennis elbow. Hi, this is Alan Willett from Tennis Elbow Classroom, and I'm here to tell you why you should rest it is not very useful advice, and hopefully spare you the frustration of finding out the hard way, after months of resting, that you're no better off. Rest is the first part of the RICE protocol, R-I-C-E, which stands for rest, ice, compression, and elevation, the first three parts of which are often recommended for treating tennis elbow. But the reality is, the vast majority of the time anyway, this RICE advice doesn't apply to tennis elbow at all, because it's usually not that kind of injury. I've already covered why ice is not a good way to treat it in another video, but what's wrong with resting your tennis elbow as much as possible? Because we're dealing with a tendon injury, and with tendons, healing just doesn't automatically happen the way we think it should if we rest it and give it time. If you follow the standard advice, if you just sit back and try to protect it by moving it as little as possible, there's no guarantee that any healing will happen in your tendon at all. Now, we've all seen our skin heal quickly and steadily by itself after minor cuts and scrapes, so it's only natural to assume it works the same way on the inside. And it does to some extent, but when it comes to tendons, healing can very easily stall on us. Too much rest and too little movement can cause muscles and tendons to weaken, and for healing to come to a standstill. Here's a quotation from Dr. Nerschel, a thought leader in the study and treatment of tendon injuries, especially tennis elbow. I quote, "Absolute rest is rust. All tissues, especially injured tendons, require tension and motion to maintain health." Unquote. To expand on that, tendons need tension and motion to heal, rehabilitate, and stay strong and healthy. Nerschel goes on to say that complete immobilization, not letting it move at all in other words, is not the proper treatment for tennis elbow because it causes muscle weakness and atrophy and decreases blood supply. And that immobilization of the elbow joint itself is especially bad, potentially leading to loss of motion and function of your elbow. Splints, braces, straps, and tape all restrict movement and circulation to varying degrees and can slow your healing down. Yes, even though your elbow may feel better when you're wearing them, like most so-called treatments, they're deceptive. I cover this as well in a separate video on braces and supports. Now, does this mean you don't need to bother reducing the activity that caused your tennis elbow in the first place? No, not at all. If it's practical for you to reduce that activity, by all means cut down or stop for a while, especially if it's a recreational activity that you can easily reduce rather than a work activity that you may not be able to avoid. The idea is to stop or reduce the aggravating activity and motions if possible, but not to stop all motion. I know this may sound counterintuitive or even nonsensical, but the fact is that regular, gentle movement is essential to muscle and tendon healing. And some pain is to be expected, since healing is inherently painful in the beginning. You can't let the pain dictate that you never turn a doorknob or take the milk truck out of the fridge with your tennis elbow arm because it often hurts. Try to keep doing daily activities as normally as you can. You're not going to be damaged by turning a doorknob, even if it does hurt like heck. Just don't spend 6 hours in a row gardening or on some home improvement or maintenance task. The key is to find the right amount of tension and motion to support your healing at each stage of healing and recovery as you progress. Now, in the very early stages, this may be just moving your wrist and elbow gently through their full normal range of motion as much as you can, repeatedly throughout the day. And soon thereafter, to introduce some very gentle stretching as the next step, and some hands-on therapy, which we'll talk more about in a minute. Eventually, you'll need to include strength-building exercises, but that may not be appropriate until the later stages, although some people can start them fairly early. The challenge with tendon injuries is to keep the healing process going, to keep encouraging and stimulating it, to keep it from stalling, because that's what all too often happens. The healing process stalls, healing fails, and your tendon gradually breaks down. And again, too much rest and too little tension and motion simply allows that degenerative breakdown process to continue on its downward spiral. It allows circulation and the healing process to stagnate. There is a balance naturally. If you try and go to the opposite extreme, you try to jump right into a challenging exercise program right away, it could easily backfire on you. Too much tension too soon can damage your tendon and worsen your tennis elbow. Now, I'm a neuromuscular therapist. I treat these injuries by hand with advanced therapy methods I hesitate to call massage techniques, as well as teach people how to treat themselves with these same advanced methods. In my opinion and experience, hands-on therapy is the best kind of tension, friction, and motion that has the most positive effects on healing. It's helpful in the early, middle, and later stages of healing. Again, the challenge with these injuries is to keep the healing process going, to keep stimulating your tendon, and regular direct manipulation by hand with the right techniques really helps with this. Now, I know this can be rather expensive if we're talking about visiting therapists like myself for treatment, but the good news is you can learn these techniques and use them to help yourself. I'm happy to be your tutor and teach you how. So, in conclusion, rest doesn't mean stopping all movement. Tendon healing is not something that happens automatically just because you rest. Rather, tension and movement are essential to your healing process. And you have to find the right amount of movement for the stage of healing that you're at right now. If you're not already here, I invite you to join us and learn more at tenniselbowclassroom.com.